Taking pumpkin seed oil may help with hair growth in men. Hair loss, also known as alopecia or baldness, refers to a loss of hair from part of the head or body. Symptoms of hair loss include hair loss in patches, usually in circular patterns, dandruff, skin lesions, and scarring. Alopecia areata usually shows in unusual hair loss areas, like eyebrows, backside of the head or above the ears, areas the male pattern baldness usually does not affect. In male pattern hair loss, and thinning begin at the temples and the crown, and hair either thins out or falls out. Female pattern hair loss occurs at the frontal and parietal. People have between 100,000 and 150,000 hairs on their head. The number of strands normally lost in a day varies, but on average is 100. In order to maintain a normal volume, hair must be replaced at the same rate at which it is lost. The first signs of hair thinning that people will often notice are more hairs than usual left in the hairbrush after brushing or in the basin after shampooing. Styling can also reveal areas of thinning, such as a wider parting or a thinning crown. Hair thinning and baldness cause psychological stress due to their effect on appearance. The psychology of hair thinning is a complex issue. Hair is considered an essential part of overall identity, especially for women, for whom it often represents femininity and attractiveness. Men typically associate a full head of hair with youth and vigor. Although they may be aware of pattern baldness in their family, many are uncomfortable talking about the issue. Hair thinning is therefore a sensitive issue for both sexes. For sufferers, it can represent a loss of control and feelings of isolation. People experiencing hair thinning often find themselves in a situation where their physical appearance is at odds with their own self-image and commonly worry that they appear older than they are or less attractive to others. Psychological problems due to baldness, if present, are typically most severe at the onset of symptoms. Infection can cause hair loss. These infections can be from dissecting cellulitis, fungal infections, such as Asthenia capitis, folliculitis, secondary syphilis, Demodex folliculorum, a microscopic mite that feeds on the sebum produced by the sebaceous glands. Temporary or permanent hair loss can be caused by several medications, including those for blood pressure problems, diabetes, heart disease, and cholesterol. Any that affect the body's hormone balance can have a pronounced effect. These include the contraceptive pill, hormone replacement therapy, steroids, and acne medications. Some treatments used to cure mycotic infections can cause massive hair loss. Medications, side effects from drugs, including chemotherapy, anabolic steroids, and birth control pills. For treating male baldness, take 1,000 mg capsule of pumpkin seed oil per day. Taking pumpkin seed oil may help with benign prostatic hyperplasia. Benign prostatic hyperplasia, or BPH, also called prostate enlargement, is a non-cancerous increase in size of the prostate. The cause is unclear. Globally, benign prostatic hyperplasia affects about 210 million males as of 2010. BPH typically begins after the age of 40. Half of males age 50 and over are affected. After the age of 80, about 90% of males are affected. Although prostate-specific antigen levels may be elevated in males with BPH, the condition does not increase the risk of prostate cancer. Risk factors include a family history, obesity, type 2 diabetes, not enough exercise, and erectile dysfunction. Medications like pseudoephedrine, anticholinergics, and calcium channel blockers may worsen symptoms. The underlying mechanism involves the prostate pressing on the urethra, thereby making it difficult to pass urine out of the bladder. Diagnosis is typically based on symptoms and examination after ruling out other possible causes. Most experts consider androgens, testosterone, and related hormones to play a permissive role in the development of BPH. This means that androgens must be present for BPH to occur, but do not necessarily directly cause the condition. Studies indicate that dietary patterns may affect development of BPH, but further research is needed to clarify any important relationship. Studies from China suggest that greater protein intake may be a factor in development of BPH. Benign prostatic hyperplasia is an age-related disease. Misrepair accumulation aging theory suggests that development of benign prostatic hyperplasia is a consequence of fibrosis and weakening of the muscular tissue in the prostate. For treating benign prostatic hyperplasia, take 1 1000 mg capsule of pumpkin seed oil per day.